So now I have the great pleasure of introducing Minka Beck-Temba, who is the founder and director of Multiple Pathways to Recovery, LLC, providing resources and peer support services to Marion and Hendricks counties, educated as a CAPRC2, a CHWCRS, and an MATS. He is a biracial man that has lived experience in homelessness and incarceration while suffering from mental health and substance use disorder due to the lack of access and encouragement to enter into recovery. He has been in recovery for over 4 years and 10 months. Congratulations and thank you. Welcome.
All right. Hey, y'all good on lunch and everything? I don't want no falling asleep. Because I get full, I fall asleep, you know what I mean? I don't want no falling asleep. But hey, I want to thank DMHA for letting me be here today, you know, and present, you know, but you might not be so welcome after I get through here, you know. All right, where we at? Okay, you can go on to the next slide, brother. I appreciate you. Equitable access disorder, use disorder recovery in the U.S. requires meaningful changes, clinical and non-clinical. We're talking about meaningful changes. Yeah, we've been talking about that. But I want to hear some changes from the audience, you know, from the organizations out there that are working, you know, to save lives. I want to hear y'all changes, you know. Go on to the next one there for me, brother. Oh, look at here. This is, who's this? CDC. Now, you know, they're behind a little bit, but BIPOC community is dying at 2 times the rate of whites from overdose. Now, this is 2 years ago. Imagine through this pandemic and everything, what's going on. But this is happening in Indianapolis. I got some statistics from the health department back there yesterday. Suicide rates off the hook, you know, number-wise, we're up by like 19%, and so on and so on. The numbers are high, disproportionate about it. Now, there's more whites down here in Indiana of overdose, and we got to help everybody, you know, equality in recovery. That's what we're talking about here. But go ahead to the next one there. This is another statistics. We see the chart here. I don't know if y'all can read that. Y'all read that pretty good. They continue to grow. Look at the Asians, blacks, Hispanic, and you look at the whites. Okay, we're catching up with them, but the populations of us, that BIPOC community, is much lower. So that shows, you know, that this is a problem. But the problem is because of access and outcomes. You know, we're being denied access and outcome to mental health and substance use disorder. But it all falls up under mental health, don't it? It's all up under mental health. Here, go ahead. Opium epidemic is surging among black people because of unequal access of treatment. We know that, right? Clinical and most effective types of therapy are harder to find in communities where people of color. Am I right? Are y'all seeing that? I want some participation now. Y'all seeing that? Yeah, okay. All right. Bias and stigma impacts the access to mental health care, black, indigenous, people of color. Now, I'm watching the news the other day. I'm watching commercials. You know, I always watch TV. That's part of my self-care, you know, just time watch a little TV, don't do nothing, pajamas on or something, you know, just relaxing. And I'm starting to see that word stigma. And we got to address these stigmas. Even in our communities, we got to address these stigmas. But what I'm not hearing is that word bias. Because when you're talking about bias, you're talking about racial issues. You're talking about social issues, you know, economic issues, you know, but it's really racial. So we got to start talking more about them biases. Because that's what's keeping us, that's what's denying us access and outcome to recovery from mental health issues, substance use disorder. Go ahead, brother. Here's another statistic. 13% of the U.S. population identifies black African American. All right? 16% reported having mental illness in the past year. Come down here, this is over 7 million. The population of what? Chicago, Philadelphia, and Houston. That's a lot of people. That's a lot of people that are being missed because of them biases. You know, we can put all the policies and procedures together, which we have to do. And I like, who was that said that from DMHA, about if we put these policies and procedures in effect, and they're on the books, that's going to prevent them negative attitudes, them racist attitudes, from preventing us from doing what we're doing. And that's true. That can help. But the U.S. Constitution been in effect how long? and we still unequal. Do you hear what I'm saying? Y'all follow me on this? Okay, all right. All right. Here we go. Go on to the next clip there. In 2018, non-Hispanic white people received mental health treatment twice as often as the Hispanic and black people. Even when BIPOC did receive care, they reported more dissatisfaction in treatment experience from mental health. We can go on and over these statistics and this. We know this is happening. So, you know, I like this about this afternoon. We're coming up with some solutions. People are talking about what they're doing, you know, and that's what it's all about. But what can we do? Give me an organization that's here, recovery center type organization. Cummings, for instance. What are you doing at Cummings? You know, give me another one. Who else is here? Another organization, recovery center. Even Exodus, yeah. Anybody else? Organization, represent the organization? Got Mental Health in America back here. We got Heather, who is that? In that recovery network, you know, but what are we doing? Okay, you know, when I look around and I see, I have a Facebook page, it's kind of my business page, but what I do basically, because I don't have much time, is I repost other people that I follow, other organizations that I follow, SAMHSA or you know, NA or AA or Celebrate Recovery, Smart Recovery. So I repost their stuff. Hopefully somebody get it, you know, and follow it, it helps them out. But what I look for in that minority health, you know, I love to see them because they got black people in the picture. They got black people in that picture because other black people can see that picture. You know, because we don't see ourselves in recovery. You know what I mean? Because we don't know about it. For one, we don't know it's possible. But I'm here to tell you it's possible. You know, I'm black. You know, I'm actually half white. But, you know, most people don't know that. You know, and I was raised in a white family to a certain age. But anyway, let me get back to it. This is what we can do in your organizations. You can start when you post, if you have black employees, or if you don't, hire some, you know, as peers. And but if you have them, when you're taking that picture about celebrating this, that, put them in the picture. Put them in the picture with you. Let them know, because some other black people are going to see that. Let me tell you our story. This year. They had a event down at the State House for Martin Luther King Day. Yeah. And the governor's there, everybody's there. They doing awards and everything. Urban League got awards and everybody got awards. So at the end, I always like to take pictures because I post them on my page. But I like to take pictures with black people, but I like to take pictures with all people in it, just show them recovery. But anyway, I let the governor know I want to get a picture. He said, oh, yeah. So his aide told me I can get in line and everything. So I walked up to the governor finally, and I said, hey, I was thanking him for signing these bills. That he's been signing a lot of bills lately, you know, regarding mental health, substance use recovery and all that. So I was thanking him about that, but then I also told him, I'm taking this picture with you. I want to take this picture with you because other people can see it. Other people in the BIPOC community can see it. You know what I mean? And if they know me personally, man, Mika, he's in recovery. Mika, man, that's a different Mika there. So, you know, it's just having that effect. So that's what y'all can do right now, tomorrow, when you hire somebody. They were talking about hiring people earlier. Yeah, that's what you can do right now. Well, okay. I'm staying too long on that. All right, let's move on. 45 minutes. You got that card for 3 minutes? All right. Drug and alcohol use disorder, treatment disparity, barriers stem from multiple layers, internal, familiar. That's our family. You know, we have our own biases, stigmas, you know, that keep us up, you know. So that's our internal. But external, man, that's racism. You know, I used to get mad. But somebody asked me a question the other day. I was in a job interview. You know, I got to work and do my business, you know, support the business. But somebody asked me in the interview, what is your greatest achievement, Mika? And, you know, I didn't really hesitate because that used to be a question that was complicated, you know. But I let my anger, resentment, and bitterness go. You know, when I let that go, I'm still able to work with racism because I couldn't handle racism. I knew it existed, but it kept me down, it kept me angry, it kept me bitter, you know, but that's part of recovery, when you let stuff like that go. But racism does exist. We know it exists, and that's another of the barriers to recovery for the BIPOC community. you know, no matter what they're struggling with, you know, is that racism. So it's a challenge. It's a challenge that we can address individually. Right now, today, like I was saying earlier, just say hi. You know, say hi, how you doing? Invite people. Invite people from the BIPOC community into your white organization. You know, let them in. You know, let's just start communicating. If we sincere about recovery. Now, if we just playing around, just keep on playing, and racism is going to rule. All right, go ahead. All righty. What do y'all see? When you seen that picture, what do you see? I need some input on that. I want to know honestly what you see when you see that picture. Black man, I ain't no doubt about that. Okay. What else do you see, though, when you see that picture? Huh? Mugshot. Come on now. What else? Be honest. Just be honest. I mean, we all friends here, right? I mean, you know. Huh? A weight or a box? Oh, no, that's like that. Yeah. Okay, a weight and a box. Yeah, that's what you see. Anybody else? I want some DHM men, people, you know, what do y'all see? Huh? I can't hear you. Angry. Okay, yeah. Boom. Thank you. All right. Come on now. Some more honesty. Come on. Criminal. All right. Okay. I think they all kind of ball around it, but that's how it happens in the BIPOC community when we show up for recovery. You know, from mental health, substance use disorder, whatever. That's what happens. I remember back, I wasn't taking it seriously at all. I was probably faking that recovery anyway, running from the police, you know what I mean? They told me I go to court, you know, or I do this program, I stay out of jail. But really, I couldn't wait to get high again, you know. I would show up at the parole, still high, you know. But anyway, that's how I felt many times. Well, I'd be in a group, there'd be 5 whites, me black, we'd be in the recovery house. I wasn't taken seriously at all. I was just looked at as a criminal, you know what I mean? And I wasn't worth nothing. And they'd be messing up more in the recovery house than me, but I get put out first. You see what I'm saying? Because of what we see when we see that picture. Go on to the next one there. Who is considered a patient and who is considered a criminal? You see what I'm saying? Yeah. Okay. Who is considered a patient, who is considered a criminal? Society issues that plays on the doctor's office, the emergency door. Okay, now this is talking about, we show up at the doctor. We got a white doctor. We don't trust him. You know what I mean? If we even get into the doctor's office, we don't trust the doctor. You know, there's lack of trust there. And that's like, what do you call that? Historical trauma. You know, this stuff is trauma. So we don't trust the police. We don't trust DMHA. If you don't know them, you know, no, if you don't know y'all, I'm getting to know y'all better. I'm starting to feel better about y'all, man. Really, I am. So that's great. But that's what it's about. You're getting that information out there, sharing that information. I just signed a contract to work on the east side of Indianapolis. They're doing a revitalization over there. There's a lot of violence over there, this and that. And, you know, I'm really happy about that, you know, to be working on that level. But, hey, they don't know nothing about recovery over there. We definitely dealing with some mental health stuff. You see the violence, that's drug related, you know what I mean? But what can we do? What can we do? We can put some posters up on the east side, you know, about, hey, recovery is possible. You know what I mean? I got to say, recovery is possible, recovery is for everyone, and recovery is what? Right, that's right. But they don't know that. We don't know that in a lot of our communities, the BIPOC community, you know? And but that's what we can do today. We can start spreading that word, you know what I mean? DHMA, I'm going to keep pointing y'all out because y'all running this show, you know. Know the facts. Carrie, loved it. I used to come take my picture all the time in the circle. I can't wait to get back in the circle, you know. And I know the people that were in the commercials. These are peers of mine, you know. But let's do that on the east side of town. Let's do that in the BIPOC community because they can get to know us and then get to know that recovery is possible. All right, you can move on, brother. Hold on, go back. Because we end up what? Courtrooms, prison, and beyond. And beyond is death. All right, go ahead, brother. All right, cultural and familial stigmas surrounding behavioral health. For example, ADHD, uninterrupted medicine. This is going back into the healthcare system. We don't trust the healthcare system, but if we start having ad campaigns, like I said, I'm seeing the stigma commercials on TV now, but we start having more ad campaigns that are addressing the stigma, the stigmas of racism, but letting people know in the BIPOC community that recovery is possible. How can we do that? Let's just start right here on the ground. How can we do that? Let's start doing that. We can put all the policies and procedures together, but let's just start letting people know that recovery is possible in the BIPOC community. And how can we do that? Y'all can answer that later because, they don't give me much time. How much time do I have? What you got there, sir? Relationships, yeah. Policies and procedures don't change that racism. We got to change ourselves, man. And again, if we are sincere about recovery for everybody, and that recovery is possible and all that, if we're sincere about that, we got to start working on that level there. And that's in their communities. Policy and procedure, okay, that's great. We got to have it. And we're going to have it. That's how things work. I'm finding that out too, Yeah, all right. So, relationship, that's great, man. Yeah, I don't even really know this man, but, we see each other all the time. Because I try to go to everything I can, And he came with me yesterday, first day. Hey, Mika, good to see you, man. I don't remember his name, you know what I mean? But I'm letting him know, hey, great to see you too, and I'm sincere about that, man. I'm sincere about that. The sister said something to me today, that's, a black woman, sister. She said something to me today, she said, Mika, I'm proud of you. You're doing your own thing, and you're doing it on your own. And I said, yeah, but you know what? Thank you for saying that. That encourages me. Well, let's encourage the BIPOC community by getting right down there face to face and talking to each other. All righty? She said, I got plenty of time. All right. Because normally I get more participation. I try to get more participation, but that's all right. We're getting participation because you're listening. I hope you're listening. Y'all looking my way. Y'all ain't asleep or nothing. Justin, what are you doing on the computer, brother? All right. Hey, check it out. There he is. Look at the brother's face. He's in the office with a black doctor. Y'all were talking about, how we got to start hiring more professionals to work with the BIPOC community, you know what I mean? But then the peers. Who is that right here? You were talking about peer. What is a peer? Now, they gave me this definition earlier. I got my first certification, Certified Addiction Peer Recovery Coach 2 with Justin. He was my trainer. And then Nate and Stan the man, And I didn't, I was like real excited. I was early in recovery, and I was like, man, this is great. And it is great. It got me going, and I was like, okay. But then later I seen, I was starting to learn about mental health. But this is like the underlying stuff. This is why we use it anyway, So I heard about Fort Wayne, mental health, what is it, mental health? Yeah. Who is that, Justin? Who are y'all? Mental Health of America, Indiana, Fort Wayne Division, I'm sorry. And I heard about the community health worker certified recovery specialist training. I said, I got to have that because they had that other element. It had that mental health element into it. So, but then the difference between a peer recovery coach, certified peer recovery coach down there with Mental Health America, Indianapolis, and then at Fort Wayne, is that when I took that, they made me submit a story. I had to show that I had a history of mental health or substance use disorder. But with the certified peer recovery coach, you ain't got to do that. Anybody can be that. But that's great. It's all get them certifications. It's all learn about recovery. But that lived experience is what you need. I can never imagine me, the brother used to be in the street, brother used to be behind the walls, doing what I'm doing now. but it was because of that substance. You know, that wasn't me, that was that substance. You know, but now I'm doing this, I'm like, okay, this is great. This is great. It's possible. Recovery is possible. We got to keep telling our people that. But I'm saying, not, you know, we can come to these events, this and that. I mean, I'm surprised, man, all the black people here today. Because most events I go to, and I got to stress this, I got to go back to stressing this. All I see is white people. But I know y'all got black employees. Bring them, bring them. Start bringing them. Start putting them in the picture. You know what I mean? If it's at the physical picture or whatever, start bringing them, start putting it so we all can see it. We can see that doctor. We know that we have somebody. We relate better. So you know, we're with our own, you know. All right, here we go. Racial Equity Initiative, which has identified stigma, discrimination, prejudice, and content of substance use disorder treatment as the top research priority. Now, did you put that paper on the table? I made up a little handout. Did we ever get that handout? You what? No. Oh, printer broke. But I had a handout for y'all because I want y'all to start doing more research on that. You know, there's a lot more to it than just say, okay, we're going to let you in, we're going to take some pictures with you. There's a difference. That's it. Oh, yeah, pass them on out there, yeah. And if ain't enough, please take a picture and give y'all a little more research on this, what I'm talking about today. All right, where we at? Go ahead, partner. MATS, medication. I'm a medication-assisted treatment specialist. Got that from Justin and them, too, yeah. But, you know, and when I first took this course, I was like, oh, man. I thought back to methadone in the hood. You know, that's what we grew up on. We grew up on methadone, you know, and it was just another drug, this and that. But then I started to grow. I started to think, you know, whatever works. You know, that's why I'm all about multiple pathways, whatever works. You know, so, you know, I know MATS works. But then even access in the BIPOC community, hey, it's limited. It's not encouraged. You know what I mean? I'm not the greatest fan of methadone, but that buprenorphine with that blocker in the naloxone, yeah. Hey, it's working. I see it working personally. I work with people working. I passed it out. I'm a drug dealer, but you know, that's why that's what I tell them. You know, I see the buprenorphine people every day at the conferences. I'm surprised they're not here. I said, "What's happening, drug dealer?" You know. But he's dealing the good drug. You know, we gotta have to take the medications. You know, it helps. It helps. You know, for mental health as well. You know what I mean? But we ain't got to stay there. You know, but we're talking about disease here. This is the disease, not curable, but treatable. So let's find a pathway that works for you. You know. All right, let's move on there. Look at that. What's that? Huh? Brain. I don't care if you're black, white, Asian, Hispanic, whatever nationality or race you're from, we got the same organ. And that drug or that mental health, how did she say it earlier? I want to change that to how she, not an issue, but a crisis. We react the same. It has the same effect on our brain. We speak different languages and all that, but what we're going through, you know, when we take that hit, it's the same effect on that brain. When we're going through with that trauma, you know, it's the same effect on our brain. Different cultures, different ways, and we're going to get into that in a minute because we have to recognize it, but it's the same brain. We're all the same. We bleed the same and all that. I know y'all heard that before. Hey, go ahead. Uh-oh. Check this out. Turn this one up. Turn this, make sure it's turned up. I want y'all to listen to this. Look at that. Cross-cultural issues in recovery from addiction. I was trying to find a black person to present this, but that's okay. I don't care who it's coming from. This is some heavy stuff here. Justin, I want you to take this now. He's a trainer. I know he's on it, but hey, he's a trainer. And if you want to train these peers and meet that person where they're at. Even though we all have the same organ, that brain organ, our cultures is different. So approach to recovery is going to be different. You know what I mean? You can't, what you're doing in Avon with Cummings, you know, predominantly white clients, but when you get that, remember that BIPOC community, their culture is a little different. I read a piece on AA. AA is the predominantly white male organization. Okay, that's cool. There ain't nothing wrong with that, you know. So it might not work in the BIPOC community like it's working in that predominantly white male population. It didn't work for me, but you know why it didn't work for me? Because I was told that if I don't work these steps, I don't get it. Well, that's probably telling me, right, we talking about words, you know, or using that certain language. If I'm told I ain't gonna get it, that's what I'm hearing. I ain't gonna get it. Because I'm still real sick right now, so I'm not gonna get it. And I didn't get it, but one thing I do, one thing I do every day, you first must admit, step one, that you are powerless over your addiction and life become a manager. I use that every day, because you got to do that. Okay, here we go. Take off.
Today I'd like to talk about cross-cultural issues in recovery from addiction. I recently did a review of the literature addressing the culturally competent practitioner in serving addicts in recovery. And one of the things that stood out for me, it was hard for me not to be deeply affected by the disproportionate percentage of substance abusers in both the Native American and African American populations. In fact, it occurs to me that any simplistic, culturally insensitive, or historically ignorant view, for example, towards just say no, must surely take into account, at least to my way of thinking, the huge historical displacement and enslavement of these two ethnic groups. There's such a high percentage of addiction in their populations, we have to address that. And I think this is where the biopsychosocial and even cultural perspective that we've been talking about in other videos, and that lies right at the heart of our program here at Cal Southern. I think that's why it's so essential. You can't look at somebody's addiction outside of their cultural, their ethnic, their historical background. To further this, I think it's ironic that treatment providers, all the way from detox hospital units to rehabs, they're also represented quite disproportionately in terms of both race and class. Professionals, for example, perhaps not surprisingly, are disproportionately white and middle to upper middle class. That is, psychiatrists, psychologists, and other therapists are most often white. On the other hand, paraprofessional staff, and here I'm thinking of chemical dependency counselors, aftercare support team members, and so on, they're most often both recovering themselves from addiction and also non-white and non-middle class. Middle class or lower. It's not hard to imagine then, is it, the possibility for poor clinical matches, or at least what I want to call empathic disconnects. In particular, professional staff, I believe, are at risk for missing their clients' unique cultural, ethnic, and socioeconomic embeddedness, unless there's a lot of clear intention and attention given to filling in gaps in understanding and life experience. I want to give you one example of existing mental health practices and assumptions that unless revised, don't serve significant populations of those who are seeking recovery from addiction. African-centered, Muslim-based, Asian, and or Native American-centered cultural perspectives all emphasize the acquisition of power, for example, spiritual power, communal power, personal power. They emphasize the acquisition of power instead of notions of powerlessness. So what do you do then with the fact that powerlessness is espoused in traditional approaches to treatment of substance abuse, including the 12-step programs? It's probably vital that we consider a different language, for sure, a different entry point than if we're talking about cultures for whom talking about powerlessness is an impediment or a block to really effective treatment. And in fact, what I'm reviewing is that programs in which emphasis is placed on group and communal healing, for example, where the focus is on interdependence instead of individualized treatment plans, and also the use of respect as much as confrontation, respect between the staff and the client. All of these are crucial from the aforementioned ethnic groups that are seeking treatment for addiction. Successful recovery for many non-white substance abusers then must be accompanied by and encompass cultural teachings that are spiritual, relational, and intergenerational. Furthermore, I think it's on counselors to self-examine both in terms of potential bias, blind spots, or even prejudices, and also to assume right from the outset that culture, including race differences and class differences, that these must be integrated right into the heart of effective treatment. As I've mentioned before, recovery integral therapist and theorist Ken Wilber, his dictum is context is everything. Certainly that's the case here as we're talking about cross-cultural values, assumption, and norms. I think the responsibility for integrating more culturally sensitive perspectives, I believe it rests squarely on the shoulders of the responsible recovery coach or counselor, and that he or she must be equipped to, with the latest of information, continual self-examination, and finally I want to say a real desire and openness to learning from the client to make for what I'd like to say would be optimal responsiveness to the recovering addict in treatment. Thank you.
Damn! I mean, excuse me. I got excited when I heard that. I said, that's what that...
Today I'd like to...
Oh, okay, you want to play again? Y'all want to hear that again? Now, what you can do, though, that paper I passed out, you can check it out. Do a little more research on it. You know, start doing research on it, you know, because this is what's happening here. You know, it's a cultural thing. It's a cultural disconnect here, you know what I mean? And like I said, we people at the BIPOC community suffer from a lot of generational trauma. I can get into the details of it, but I think you know what I'm talking about. And that's that cross-cultural stuff. So we got to start approaching recovery, meeting that, when we say meet that client, or meet that person where they at, okay, well, hey, I understand you, brother. I understand you, sis. You've been through that, this, and that. I know, you know, I've been there, I've done that. You know, but then, you know, we ain't excluding nobody. We're just trying to include more people in recovery. You see what I'm saying? So I pass out, look, do a little more research. Start doing a little more research. If you're sincere and honest about it, do a little more research and start sharing that. Start sharing that throughout your recovery programs in your communities. You know what I mean? In your communities. How much time I got left? 10 minutes, man. But, you know, when it comes to policy and procedure, you heard what the man said, you know. We got to consider that. And that's what I think we're missing here. And I go back to that word stigma. You know, we're missing that stigma. We ain't talking about that stigma. Now, why we ain't talking about that, I got my own opinion, you know, which I'm gonna go ahead and share that with you. But, you know, because it's sensitive. Racism, racial stuff is sensitive. Nobody wants to, white people don't want to talk about it because, you know, feeling maybe a little guilt, whatever it is, shame, whatever it is, you know. And then you know, that one response, oh, y'all should get over that. That happened a long time ago. No, it's happening every day. It's still happening today. You know, I'm thinking about, you know, the policy and procedures and this and that we're trying to implement and we are implementing and, you know, but, you know, who did you talk to? I don't know. You know, I mean, when the DMHA talks about we doing this and that and your research and everything, who are you talking to? Are you talking to that community? You know, or you just talking to somebody that has a degree that works in that department over there and runs this organization, which doesn't really have, you know, that leadership. Somebody talked about their leadership. We got to get them leadership roles, you know. Share the wealth, you know what I mean? But we're talking about saving lives here. We ain't talking about no money here, but we know it's about money. But hey, we're talking about saving lives, so share that spotlight. Take that picture with that one black person that works in your company? You know I'm joking. You got it. Okay. Okay, 2. All right. DMHA got a lot of them, you know. It's that's great. That's great. That's the state of Indiana. But then, you know, check it out. They're doing an evaluation on the DMHA. You know, I just got a little frustrated there. I said it, but I really wasn't frustrated. I was being honest. I said they were talking, you know, asking us different questions. And I said, hey, just look at the national rating. Indiana's like 42, 43 for mental health and addiction recovery. Is that the number, 42? And out of 50. So that tell you a lot about Indiana right there. You know, okay, we got a lot of work to do, and we're doing it. We're here today talking about doing it. Yeah, are we sincere about it? Huh? Okay, see some nods. Yeah, I want to hear yes, right on. You know, I got it. But hey, try to get y'all a little more excited. That's all. You know, because I am excited, man. I'm excited, and I'm grateful every day. And like I said, I want to thank DMHA for letting me do this. And if anybody else want me to do this with their organization, or people, you know, event they may have, I'll be glad to share. You know what I mean? Because we got to start talking about it. But not only talking about it, start doing it. Okay. I got a few more minutes.
Well, thank you so much. Thank you as well. And I was wondering if you have opportunities to share the love with other African American males, and that they're doing what you're doing, because we'd love to get more people talking. Well, we probably, all of these people here, like, oh, wait, I said these people, but all of the employees, we learn quickly, but thank you. I think it's a strong message.
I'll share with anybody. There you go, doctor. Like that.
Well, and I think my question is somewhat similar thought is, because, and I had the opportunity to meet you in person and talk with you a lot yesterday, so I appreciate getting to know you more. You make the video you showed, I think, was powerful, and the thing that was standing out is kind of course, the demographics of folks who are in the helping professions. I think we still have a shortage, of course, though, of black peers in the state. And I'm wondering for you, I mean, you're one of them, and you've been successful in starting an agency. I'm wondering what inspired you, what was the thing that made you say, yes, I can do this? You told us a little bit about that, but I want to connect that to, like, how do we recruit, how do we get other black men and black individuals in general in the peer and CHW space?
You got to go into the neighborhoods. You got to go in the neighborhoods. You know, you got to put them posters up. You know, you got to put that advertisement up. In the media, we stay on media a lot, social media. You got to put it out there. You got to go there. Can't sit down in the state office building or whatever, you know, and come to these little conferences. We don't come to this conference. I wouldn't know about this conference if I wasn't following this stuff. You know, if I wouldn't saw it, you know, people like Carrie, whatever, sending them email, or I'm signed up for that, I wouldn't know this. So we have to go into their communities. I'm talking about directly in there, you know, and talk to them people, man, relate to them people. And peers do that. You know, that's that peer. You know, I can go out. I ain't scared. But then I'm also scared when I go into that neighborhood. I'm scared to a degree, like, hey, not that if I'm going to be all right, but what can happen, you know, what can happen. Because I'm in recovery. And, you know, I know the, what they call stages of change and all that, and I know that reoccurrence is in there. I'm not immune to it. I don't put reoccurrence in my program, but it's possible. I got family still smoke weed, you know. But I'm over there talking to them. But on the second bump, I'm out the door. You know what I mean? We're not even on the same level. But I'm going in there. But I've always had that little fear that, hey, I'll take a hit. I can take a hit and get on out here. I can't do that. I can't do that. So I have that fear, but I don't have no fear going in that community because, you know, the way I walk, the way I talk, it's still in me. You know what I mean? So, yeah, that's what we got to do. We got to go into the communities. Anybody else? Because I know I'm running out of time now.
Okay, so I don't have a question. This is to you directly, though. I absolutely want to thank you for everything that you've shared, but I want to most of all thank you for being so vulnerable It takes a lot of courage, yes, to come up, to tell your story, and then what you just shared with us, that is so real, and it is so powerful, and I feel that is a message that will reach a lot of people. You know, if we are able to get this copy, you know, of this portion of the conference, and to be able to share that with people, and I think this is answering the question for the doctor too, but to be able to show people themselves, because in any type of recovery, when we're working with people, we have to see, and this is just whether it's working with persons experiencing homelessness or any type of addiction. When we can see others as ourselves, or when we can see ourselves in others, because we may not all have the same addictions, or we may not all be fighting the same issues, but it is a human issue. It is one of humanity. It is one of compassion. And in order to reach people, we have to be vulnerable. We have to be transparent. You know, he could say, well, hey, I'm sitting here and I'm running my own organization. I'm doing something good, and I have all these letters behind my name. But what do those letters mean if you cannot reach me just on a basic human level? And so I thank you for that. Thank you so much.
Thank you for saying that. That's encouraging to me. You know, it gives me that, hey, I might be doing something here right, you know, and I'm definitely feeling, you know, like I am, but y'all reaffirmed that. Appreciate that.
You're out of time, but there was one more over here.
All right.
So take it, I'm giving it to you.
All right, right on.
Because I
Thank you.
took some of yours, so I'm giving
All
it to
right,
you.
right.
Migo, what's my name? What's my name again?
Brother man.
Now, every time I went to a conference, he has always been an inspiration. Every time I talk to him, he's always got a smile on his face. He's always been inspirational. But the one thing I was going to say too, Doctor, was that when we meet people, it's kind of like what you were hitting on, is letting them know that their recovery is important. Because with our coaches, it's the same thing, letting them know that, hey, you can use your recovery as a way of getting into this field. That your recovery is something you can use as a way of helping other people. And I think a lot of people do not realize that can be a way of helping other people, and you can get paid to do it. Because a lot, yeah. You know what I'm saying? Because I think because peer recovery is something new. It's not been around really long, but I think a lot of people don't understand that they can take their recovery and they can use it as a way of helping other people, but also as a career. I think start working on a career. So many people just don't know that because we work with people coming into the justice system and coming out of the justice system, and through that process, a lot of them say, hey, look, I'd love to do what you do. And so we give them that opportunity to say, hey, look, there's opportunity for you to possibly do that in the future. When you get out, we can work with you, show them how to do that process, and some of them start going towards getting their certification.
Hey, thank you, Brian. Yeah, I remember that, Brian. But hey, career. I used to be a career criminal. Criminal, is that how you pronounce it? Yeah, I used to be a career criminal. I used to be a career person that was dependent on substances. You know, changing that wording up. You know, we don't use that old word. But anyway, I used to be that person. But yeah, this is amazing, man. I can sit here and talk about all that negative stuff that happened in my life and use it in a positive form. You know what I mean? That's recovery. Wait a minute now. And recovery is what?